Hello and welcome. My name is Dr. Treasury. It's nice to meet you. I understand that you aren't feeling particularly well today. Tell me a little bit about what's been going on. Okay. So a little bit of a bump to the head and you've had a headache ever since. I see. Okay. What I'm going to do today is an ASMR cranial nerve examination. So we are just going to be testing your cranial nerves just to ensure that everything is as it should be after your little head injury. Okay. Good. Alright. I'm going to begin then, as you bumped your head, by just having a look at your eyes and testing your vision. So what I would like you to do for the moment is just keep your head nice and still, but just follow my fingers with your eyes and tell me if you have any blurred or double vision. So can you see quite clearly that I'm holding up 2 fingers? Does it look like more? Do they look blurry? Okay, just going to move them towards you. Tell me if they get blurry or you experience any double vision. And away again. Good, okay. I'd like you to try to focus on my finger, please. That's it. And now switch your focus to my nose. Good. And now can you focus on my finger here? And back to this finger. Okay, and back to this one. Back to my nose for a moment. And focus on this finger. Good, okay. Now keep your focus on my nose just for a moment and see if you can tell me how many fingers I'm holding up whilst looking at my nose, don't you? 2, very good. And what about on this side? How many fingers am I holding up? Keep that focus on my nose. 3, well done. How about now, can you tell? 4, well done. And how about now? 1, very good. Okay, your focus seems to be alright, but I'm going to see what happens to your eyes when we put some light on them. So again, just looking directly in front of you, I'm just going to bounce this light into your field of vision for a moment. I don't want you to look at it though. Keep focusing on my face. Good. Good. And looking directly forward still, I'm just looking to see what your pupils do now. Just for a moment, switch your focus to the light for me. Just keep your eyes on it as it follows around from one side of my hand to the other. Good. Okay. So, looking at the light itself now, keep your head nice and still again, but focus on the light. It's going to move around your peripherals, and I'd just like you to watch it. focus on it for a moment or two more. You can blink as much as you need. Good, and just look at my nose for a moment. Okay. Back to the light. And back to my nose. You are doing a brilliant job, well done. I'm going to cover up your right eye now, and I just want you to watch this light here with your left eye. Just having a really good look at that pupil there to see what it's doing. Switch over to the opposite side now so we can have a look at your right eye. Good. Okay. Okay, how's that feeling? Do you have a headache at the moment? Okay, your focus does seem to be fine and your pupils are responding normally. I just want you to tell me when the light disappears out of your field of vision, okay? So tell me when you can no longer see it. Good, and then tell me when you can see it again. Very good, so keep him focused directly in front of you, not following the light. Tell me when you can no longer see it. Very good, and tell me when you can see it again. Wonderful job. Tell me when you can no longer see the light. That's great, and when you can see it again. And when you can no longer see it, and when you can see it again, when you can no longer see it, good, and when you can see it again, and when you can no longer see that light, and when you can see that light again. Very good, and when you can no longer see the light, tell me. And tell me when you can see it again. And when you can no longer see it. Very good. And when you can see it again. That's great. Well done. So what I am going to do now is check on your muscle function in your face. So what I would like you to do for me for a moment is just blink your eyes closed as tight as you can. That's it, really, really squeeze them closed. Blink, blink, blink. Good. And release, open your eyes again. Going to tap on your head. Just to check your blink reflex is normal. So if I do this and this, good, very good. If you could please smile for me, a nice big wide smile. stick out your tongue. And now place your tongue on the roof of your mouth. Very, very good. And stick your tongue back out for me. That's it. And relax your face. Okay, I'm going to place my hand on the left side of your face here. And I just want you to lean into my hand. So I'm going to press against your face and I want you to resist that pressure. Good. The same on the opposite side. Resist that pressure. Good. I'm going to place my finger under your chin and I would like you to try to open your mouth as I try to keep it closed. Very, very good. And now I'm going to place the heel of my palm on your forehead and I'd like you to lean into that as I try to keep your head from moving forward. Very, very good. Okay. I'm going to place my hands on your shoulders and I would just like you to try and shrug. That's it. Very good. Keep going. I'm just checking for symmetry. Great. And if you could please puff out your cheeks for me, nice and big. That's it, very good, and relax them down. Now I would like you to raise both of your eyebrows. Good, and relax them down. Very, very good. Have you had any difficulty at all in swallowing? Are you able to drink normally? That's great news. I just have a little glass of fresh water here. So I would just like you to have a little sip of that, if that's okay. I'm just going to listen to you swallowing. Very good. Did that feel normal? Any resistance there or any pain as you were swallowing? No, that's great. Okay. How has your sense of smell been? You think normal? Yeah? Okay. I just have 3 different scents here in these little spray bottles. Firstly, could you tell me what colour these are? So what colour is this one? Red, very good. And how about this one? Purple, that's great. And what about this one? That is pink, very, very good. So I'm going to spray the red one in front of you and I would just like you to take a big, deep inhale in through your nose and let me know what you can smell, okay? I'll just spray this up into the air in front of you. Big deep inhale through your nose. Good. And can you tell me what scent that was? It was orange. Well done. Very good. Now the purple one. Same again. Big deep inhale through your nose. And exhale. Well done. Can you tell me what scent that is? That is coffee. Great. Okay, final one then. The pink one. Just in front of your face again. Big inhale through the nose. And exhale. Can you tell me what scent that was? is lavender. Yes, well done. Really, really good. Now how about your sense of taste? Have you noticed any changes at all? Very often if there's an issue with your sense of taste, it can also be intertwined with smell, but that seems to be okay, so seems to be normal as far as you're aware. Shall we check it out? Okay, let's get that tested then. So I have a couple of different little dropper bottles. These are unsweetened, vegan and perfectly safe. So all I'm going to do is just drop these onto your tongue, a couple of drops, and I'd like you to tell me what flavour it is, okay? Here we go. Here's the first one. Just stick your tongue out for me. Good. Okay, just have a moment there with that flavour. See if you can identify what it is. It is chocolate, well done. Okay, here's the next one then. So just stick your tongue out for me again. 1, 2, 3. Okay. Sit with that one for a moment and see if you can identify it. Lemon, well done. Okay, one more of those. You ready? So if you could, that's it. 1, 2, 3. Let me know if you recognise that flavour. It is coffee. Well done. It's very distinctive, isn't it? If you had any issues with your sense of taste or smell, you wouldn't have been able to get any of those. It would have been much more difficult for you. So I think there are no issues there. Okay. Great. Okay. I'm going to test the sensations in your skin now. Do you mind if I just have a quick look at your face? Okay, thank you. So I'm just going to press the skin in a couple of places on the left side of your face here. And I'd like you to tell me if there's anywhere that is either numb or tender. Okay. Down towards your chin. And across to the right, is anywhere there numb or tender? Across your forehead. Does that all feel normal? Yeah. Good, okay. I have this little makeup brush here. It's got a soft, fluffy end and a hard plastic end. So I'm going to press this on different areas of your face, and I would just like you to tell me whether the sensation you feel is soft or dull. a little tester for a moment. So the fluffy end is soft and the hard end is dull. Okay, wonderful. I'm going to need you to just close your eyes for this one. No cheating. Good. Here we go then. Is this soft or dull? Soft or dull? Very good. Soft or dull? 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 Excellent. You did a really, really good job. You can open your eyes again now. Great. Okay. I'm going to have a little look inside your ears now. We're going to check your hearing is normal. So just before I do, if we stay quiet just for a moment, I just want you to tell me if you can hear any ringing in either ear, okay? Right, here we go. Do you hear any ringing in your left ear? No? That's great. Do you hear any ringing in your right ear? Perfect. Okay. I have a little otoscope here. So I'm just going to place this into your left ear canal. Just have a quick look to see how it's getting on. Okay. Looking really good in there actually. It's nice and clean. No signs of irritation or infection. Have you cleaned your ears recently? You had them professionally done. Good idea. Okay, let's have a look in this right one then. It's great news. It's much the same on this side. Lovely and clean and clear. No signs at all of any irritation or infection. That's great news. So let's go ahead and just check that your hearing is working as it should be, okay? So I'm going to make a little sound in your right ear, and I would like you to tell me what number I'm whispering in your left ear. Okay. 199. Very good. Let's try the other side. 911. Good, okay. Can you tell me now, with your eyes closed, which side of your head the sound is coming from, your left or your right? Left, very good. And again. Very good. Good. And tell me now which direction the sound moves in. So does it go left to right or right to left? That was left to right, very good. How about now? It was right to left. Well done. That's great. So it seems as though your cranial nerves are responding normally. We have checked your hearing, your ears, your sense of smell and taste, your muscles, your swallow reflex, your sense of touch on your face, and also to make sure that your vision is working as it should, so your eyes are responding normally to the light. So everything is as it should be. You don't appear to have any form of concussion or anything to worry about. If your symptoms don't improve or get worse, then do come back and see me straight away, but I think you are on the road to making a full recovery, okay? Good. It was wonderful to meet you today. I hope you enjoy the rest of your day, and I will see you again very soon.